Hi guys, and welcome again to my channel. This is Crazy by Austin Munara. Uh, this is episode 8. In episode 8, we're going to look at paranoid, schizoid, and schizotypal personality disorders. So these are personality disorders from mental illnesses, right? So paranoid is the disorder where people and the patients experience distrust and unsureness, and like for example they feel like people are talking behind their back and stuff. Schizoid involves like social detachments, not forming friendships. They have a hard time forming friendships and friendship bonds. They're just detached. Schizotypal is where you have uh, what's it called? Uh, uh, you know, odd behavior, odd social behavior, odd behavior-ish, stuff like that. So in these personality disorders, we look at the mistrust and detachment from social life. Yeah, so this mental disorder affects patients because they have a hard time to form bonds, being close to people, mistrust, such things, such personality disorders. They don't actually have issues thinking they're other people, but they do experience mood swings, uh, distrust, such stuff. Uh, so there's a treatment for it, includes therapy and medication, stuff like injections, constant visit to a psychotherapist for psycho evaluations, things like that. So I would say it's not the worst thing in the world. You wouldn't die from it or you wouldn't harm others, but you'd experience things like anxiety, depression, um, you know, such stuff. Now, this is something cool you can partake in, in terms of thing. Uh, you could also visit your local designer merchant for drip for such stuff. I do believe the medication for such disorders are a bit expensive, by the way. We won't talk about treatment and not bring up the price. So such stuff do tend to be a bit on the higher side, a bit expensive, really. Uh, um, this should be one of our final episodes of the show. We've looked at a lot of things. Personality disorders. This was the second one. We do believe that uh, this show could help you understand such matters clearly. I gave out some of my expertise about these matters, what I've been educated with about this, so I put it in a show. I wouldn't say I'm a doctor really, but as you can see, I have created a class of mental awareness and mental illnesses. So, yeah, I was hoping that this could bring you to the level of expertise that I have become over the years. Uh, Such medications such as antipsychotics, quetiapine, anxilipine, I think it's called anxilipine. uh, these these medication help with antipsychotic reactions. um, After a couple of weeks of taking them, a couple of months, all the insanity that you experience due to drug consumption or trauma, all of it will subside. And you would, funny enough, they work, and you would just end up into your normal self. Personally, I've taken them, and you can see how I behave. You see, I used to experience a bit of psychotic episodes, seeing things, feeling things crawling all over my body. I Now I'm just good. Easy, just chilling in the trap, you know, trying to figure what the papers are at. So, yeah, personality disorders, man. You need to stay clear of such crazy things, man. You need to watch what you consume. Any bad thing, like certain drugs, like high levels of tobacco, weed, alcohol, strong alcohol, uh, strong concoctions, mixtures, and cocktails. Those things usually bring about psychological imbalances. Uh, you can see certain people are affected by anxiety to a level that they become having personality disorders. So such thing as paranoia, be easy. If you see signs of these things happening to you, it's better you act swiftly. But in my personal opinion, I would recommend you just go to the pharmacist and ask for some medicine, because going to the hospital could lead you to a long-term diagnosis, which could be totally burdening to your experience. You do not want to go around town hiding that you're a schizophrenic, and your doctor told you that what you're going through is schizophrenia, and that you're under medication, and you don't want to be committed. These things, they get really ugly really fast. So it just might be easy, man. You take a pause and a break on the lean. Take take a pause on the henny and just chill. These things could harm you. Uh, these drugs, these drugs are not for everybody. These drugs will kill you, man. Make you go insane. Cuckoo boinkers. So what I would tell you is that chill. Don't be in a rush to tell anybody about these things. If you have a buddy who's on the pill, you give him a call. Try to take some antipsychotics. If you're feeling things crawling on to you, you're getting paranoia, you don't want to hop into the shower. At least usually happens to me. Paranoia ati watu wakiniona sijui watasikia kucheka. Be easy. Okay, so that was the paranoia episode, personality disorders. I hope you enjoyed it.